Thank you for having me here today and for coming tonight to be a part of this talk. I am certainly not a good home chef. I mean, I try, but I'm not the best. So if anyone has food-related suggestions, ideas, how you creatively use herbs and spices, please, feel free to raise your hand and interject, and we can share with the group here your creative ways of using these healthy herbs and spices. So, we know that herbs and spices have been used by humans for thousands of years. Some of the different applications for the herbs and spices ranged from making foods taste good to some more unusual ones, like the Egyptians would rub herbs and spices on the mummies to when they were preserving them to cover up smells and things like that. Kind of interesting, but nonetheless, herbs and spices have been a part of our cultures for thousands of years. Nowadays, they're mostly used for taste enhancement, for preserving foods, and of course for their medicinal purposes. And again, historically, the spice trade, herbs and spices have a lot of value even today, but historically as part of the commerce in history. So they come from seeds, berries, barks, and roots of plants, as well as saffron, for example, is from the reproductive parts of the plant. So all of these different aspects of herbs, or of seeds, berries, bark, and roots. They can be consumed fresh or dried in infusions, in vinegars, or in oils, or there's other preparations that, aside from these listed here. Anyone else use herbs in a different way than fresh, dried, or infusions? Okay. So here's a picture of what some of these spices look like. And as Holly mentioned, you may get a whiff of some of those spices over there. Feel free to look at the end of the talk, see if you can identify all the herbs and spices over here. And all of them, we'll be talking about tonight. Are these familiar? The picture here, all these herbs and spices are familiar to you? We can do a quiz. How about a quiz? How about this one? How about this green leaf? Bay leaf. What is that one? Bay leaf. Mm-hmm. I think these are allspice berries, I'm pretty sure. I mean, this is a good quiz for all. How about this one? This is an Indian spice. Fenugreek. But it looks like corn, right? I'm pretty sure it's fenugreek. And then this red one? Chili peppers. How about this one? Another Indian spice. Cardamom. Mm-hmm. This one's it. Mm-hmm. That one's very distinctive look, right? This one we eat a lot of, probably. Rosemary. Some of these are guesses, what they might be, the powders and things. But what's unique about this picture? What are some of the different attributes you can see from this? Colorful. Texture. Mm-hmm. When you think about these foods, or when you see the picture of them, do you think about the different ways they smell and taste? Just kind of evoke that sensation for you. Very strong tastes, right? When you use an herb or a spice, you use 1/4 teaspoon, right? Or 1 teaspoon, and it flavors an entire dish. So they're very concentrated in flavor or color. So these are some clues that these foods are particularly good for us. And we'll talk more about why they are. So herbs and spices have been studied in a variety of different applications. Some of them are just from traditional medicine, where there may or may not be a lot of, hard evidence, but we know anecdotally over time and over years and people practicing that they can have different effects, health effects on our body. So they range anywhere from blood sugar management, cholesterol level management, digestive health, that's kind of a broad statement, lowering blood pressure, reducing joint pain, and some potentially even for increasing libido. Other uses, though, other than these medicinal purposes, are often used by dietitians, especially if you're trying to reduce salt intake. You can use lots of herbs and spices in place of extra salt in dishes. Or things like warm spices like cinnamon, ginger, cloves, cardamom. You can use those in place of sugar in recipes. If you're trying to cut back on some of the sugar, use some of these sweet tasting spices. You can also use flavor-rich herbs and spices for not adding as many fats to recipes. You can get a lot of flavor out of the herbs and spices. So before we start talking about all the science behind these herbs and spices, we're going to have to define a few terms to make sure we're all on the same page. So what is inflammation? Has everyone heard that word before? Inflammation. It's a big buzzword in the last 10 to 20 years or so. There's acute inflammation and then there's chronic inflammation. Most of these herbs and spices that have anti-inflammatory action have it in respect to chronic inflammation. An acute inflammation is you get very sick with an infection, or you are in a very serious accident, or there's some kind of trauma to your body. That's acute inflammation. Chronic inflammation is when there's kind of low-grade damage happening to your body repeatedly over a lifetime or, a certain period of time. So what your body does, it's part of the healthy immune response, and it's how our body repairs from these insults, is chemical signals begin and cells rush to an injury site to make repair. That's kind of that acute inflammation again. There are these things called cytokines that are released. So that's a word you'll hear a lot if you do any more reading about inflammation. And then in chronic inflammation, it's those cells always being stimulated to go and make these repairs at different sites. And it's your immune response again. But in chronic inflammation, your body kind of never turns off that immune response. So it could be kind of hyperactively trying to make these repairs and causing this chronic inflammation. So acute inflammation is good. Our acute response to an injury is good. Chronic, we think now, is linked with nearly every chronic disease: heart disease, diabetes, high blood pressure, cancer, and on degenerative diseases like osteoarthritis or other neuromuscular conditions. And so we hear a lot about this word antioxidant. So what does that mean too? So the scientific way of describing this is that antioxidants neutralize or eliminate free radicals, whatever a free radical is, right? So this picture here in the corner, I know it's hard to see, is showing this one here is a free radical. These are little cell bonds where little cells will bond together, without getting too technical. What that red circle there is showing is there's an unbound place on this. So it makes this molecule or this atom unstable. So if you have this unstable thing in your body, it can cause some damage. So an antioxidant is that lighter blue one. It'll donate an electron to this free radical and it'll quench that free radical and make it more stable so it's not able to cause the damage. That's the kind of very simple, broad overview of it. So again, the free radicals are unstable molecules that arise during normal metabolism. Our body's always making these little free radicals, or say you're exposed to cigarette smoke or pollution or something like that. Those are free radical damage that could be happening to our body. Thankfully, our body is able to try to make these repairs, and again, via diet perhaps and foods you're eating that are high in antioxidants, you can help your body make these repairs. So antioxidants are good because they can prevent or delay certain types of cell damage. Apoptosis. Have you guys heard of this word before? No? Okay. So apoptosis is something that our cells normally do. If you've ever heard someone say your cells commit suicide. So say something's going wrong in a cell, it has these mechanisms to destroy itself. That way it doesn't keep having this damage occur. And this is, again, the very simple and a dietitian representation of what apoptosis is. A doctor, I'm sure, or a scientist could give you a much better definition. But it's your cells, they will turn themselves off or kill themselves. That way they don't keep replicating some problem, or just over time, these cells need to be replaced with new, fresh cells. So it keeps our body's natural process of cell division, or mitosis, in check. Insufficient apoptosis can lead to uncontrolled self-proliferation, that word, or growth, such as cancer. Similarly, though, too much apoptosis can lead to, again, neurodegenerative conditions and other types of disorders. So we want this optimal range, not too much, not too little. It's kind of funny, though. You think, oh, cells committing suicide, it seems like a bad thing, but it's a good thing. It's a protective mechanism in our body. So we want certain compounds to promote apoptosis, just not excessive apoptosis. Angiogenesis. Anyone heard of this one before? Yeah, a few hands. So angiogenesis refers to the formation of new blood vessels. So all the cells in our body have to have blood flow. You have to have blood supply. That's how we get vitamins, sugar, iron. That blood carries all those components, and those are what our cells need to function, in addition to thousands of other components. So the formation of new blood vessels is this process called angiogenesis. Those blood vessels are also involved in not just the growth, but migration and differentiation of our cells. So there are chemical signals in our body that help promote this process. And again, all cells, including cancer cells, need blood flow to survive. Phytonutrient or phytochemical. Have you heard of this word before? A few people? So I like to say these are what's in fruits, vegetables, herbs, spices, whole grains, nuts, seeds, beans, lentils, all these plant foods that are not vitamins, minerals, or fiber. It's these other components of why plant foods are particularly beneficial to us. So they're the cancer fighters, we say, in foods. It's all these phytonutrients. So again, herbs, spices, vegetables, fruits, beans, whole grains, nuts and seeds. I should have put those on there. They're not there too. They also contain phytonutrients. And these things, they help with cancer, but again, any chronic condition or any condition with an inflammatory component or just a degenerative component potentially could be modified with intake of phytonutrients. Here's a few. Now, I put this slide up here to show you that they are a bunch of complicated words, and I will try my best to pronounce some of these, but it's very challenging. But some of them you may have heard before, and we'll say a few more, like lycopene. I didn't list that one here, but you probably heard that one. That's a popular one. Resveratrol, have you heard of that one? Those are phytochemicals. So you may have heard the word, but maybe not known it was called a phytochemical. Or polyphenols. There's carotenoids or beta carotene. That's a phytochemical. Isothiocyanates. The only thing significant I can tell you about this word is that cyan, that part of that word is Latin for purple, I think, or red. Blue. Oh, thank you. Someone knew better than me. Blue, thank you. I know that from my printer cartridge only. And so that is a clue that tells you that compound probably has blue in it. So think blueberries, think beets, and some of those purpley blue colors. They probably have isothiocyanates. Chlorophyll, what color is that one? Right, we know that one, that's easy one. Biology 101, right? That's a phytochemical that's giving the plant the green color. Phytosterol, has anyone heard of that one before? Or phytoestrogen, people hear that term a little bit more. That's found in soy foods and some other nuts and seeds. So there's hundreds and hundreds of these. So then, now that we know where they're found and some clues like the color and the smells we were talking about earlier, we got to go a little bit deeper. It's not even just that simple. No nutrition topic is just that simple, I wish. So generally, deeply colored plant foods have a lot of phytochemical content. But how about garlic, right? White. But super, super nutritious, right? And super good for us. We know that. You've heard it. Oh, garlic, it's good for your heart or whatever. So color alone is not a clue. If it doesn't have a strong color, though, it will probably have a very strong smell or taste or pungency or something like that. So that's another clue you can use, is the flavor. And sometimes it could be high in something and you don't realize it, like spinach is really high in beta carotene. And does anyone know what color beta carotene is? Orange, right? But spinach is green. That's because the chlorophyll is kind of covering up the orange color in it. So if spinach had no chlorophyll, it would be orange, which is kind of fun. And then temperature, is another way we can, it's a way we can modify a food that we're eating to give more benefit out of it. So some phytochemicals are better raw and some are better cooked. So like again, the lycopene, to go back there, if you know anything about lycopene, they'll say, oh, you get the most out of cooked tomatoes instead of raw tomatoes, which is sometimes counter to what we think, right? People say, oh, everything's got to be raw to get the most benefit. Well, it's not always true. And even like blueberries too. You think raw blueberries are the best? According to experts above and beyond me, raw blueberries are not as nutritious as like partially cooked blueberries, or like even some of the, like if you made a blueberry compote or something like that, which is kind of fascinating. So what's the answer to that is, say, have a variety in your diet, some cooked, some raw. If you know the difference, like if you know which one is better cooked or raw, try to follow those guidelines a little bit, but more importantly, enjoy food in a bunch of variety of ways and different preparations. So now we're going to kind of go through a few different select herbs and spices. And here's where, if you have your favorite way of using these herbs and spices, please interject and let me know what your tips are, or let the group know what your tips are. Cinnamon. Anyone want to guess, or anyone heard, what are some benefits of cinnamon? Blood sugar, right? So I heard people say blood sugar. So it helps lower your blood sugar, not raise it, right? So cinnamon is from Southeast Asia, and it's actually the bark of a tree. And again, I have a sample of whole cinnamon, not ground, and you can see it's kind of like a curled piece of wood-looking thing. They scrape it off the bark of a tree. It has high antioxidant, anti-inflammatory, antimicrobial, which is like antibacteria type of thing, and anti-tumor properties. It's anti-angiogenic, so again, these words that they're going to be repeated because a lot of these compounds have similar health benefits, some in varying degrees. And they think anti-angiogenic, so reducing the blood vessel formation by inhibiting vascular endothelial growth factor. Has anyone heard of that VEGF? Anyone on treatment? You may have heard that term VEGF, your doctor may have said, depending on what type of disease you have or don't have. So most of the big studies in cinnamon are related to blood sugar and diabetes. And so it does appear to improve fasting blood sugar in people with type 2 diabetes and may even lower blood lipid levels. That first slide was more in regards to the cancer protective values or the chemoprotective values, and these have more to do with the other health benefits of cinnamon. So how does it do it, or what's in it? Are the active compounds like cinnamaldehyde, eugenol, tannins, proanthocyanidins, again, complicated words. Do you need to know those specific terms? It's kind of fun. What you need to know is I should eat this food more often, and so how can you incorporate it? You can combine it with flavors that it complements well with. So chocolate, fruits, nuts, other spices. There's a sheet, one of the sheets over there, one of the handouts, is tips for integrating herbs and spices into your everyday. Does anyone have those with them in their lap? Cinnamon's the first one on there, I believe. What do you guys use cinnamon for?
Oatmeal.
Oatmeal. So you can put cinnamon in your oatmeal. That's one of the easiest ways, right? If you eat oatmeal. You can coffee or tea, right? Starbucks has it right there on the counter. You can just sprinkle some nutmeg and cinnamon on your coffee or tea. Baking, of course, right? That's classic use. Cinnamon sugar, yes, on your toast. But it's better than just sugar, right, without the cinnamon. So also other creative ways I've seen it is like you can put it on your Greek yogurt. Again, you're trying to maybe have a plain Greek yogurt, but you're like, how can I make this taste better, than just plain Greek yogurt? Put some cinnamon, chop up some nuts, put some fruit on it, and you can maybe simulate that kind of sweet spice kind of taste. Or there's other tips. You can make tea. There's lots of different teas that have cinnamon in them, like those Good Earth tea bags, not any brand in particular I'm promoting. There's just a really strong cinnamon taste to them. So lots of herbal teas have cinnamon and herbs and spices in them. You can use cinnamon in savory dishes too, right? If anyone does like Moroccan dishes or some of the Mediterranean dishes, you can even have a bulgur kind of salad with some cinnamon in there. So you can incorporate it into savory dishes as well. Turmeric. Has anyone used fresh turmeric? And I don't know if I'm saying it the right way. I'm just saying it the way I say it. Some people say turmeric. Either way, I'm not sure there's a proper way. So it's related to ginger. So if you notice, if you use fresh ginger, you'll see it looks similar to ginger. The pieces are a lot smaller than the big ginger plant, but ginger and turmeric are these rhizome plants. You can use it dried or fresh. Most people, I would say, use it dried over the fresh. So again, ginger family, distinctive yellow color, also native to Southeast Asia. So it has those same antioxidant, anti-inflammatory properties, but also some antiviral properties. We think it helps our body to eliminate potential carcinogens and again, anti-angiogenic properties, and may induce cell arrest or that apoptosis, that cell death. So it's a real popular one, right? This is like a buzz spice right now, I would say, super trendy. How do you guys use turmeric?
Use it in tea also.
Tea, okay. Oatmeal, okay, oatmeal again. Curry, curry's classic, right? That's where we mostly see turmeric. It gives that distinctive yellow color to Indian curries.
Boil it in water and put a towel over your head and breathe into
Oh,
cold.
all right, so here's a creative one. Boil up some water on the stove, gently boil, and don't get too close to it, of course. Put a towel over your head so you're capturing some of that steam, and he's put turmeric in the water and supposed to be helpful for colds. What's tricky about the herbs and spices and all the research done on this is that it will be difficult to find something that says 100% absolutely does this. When we do studies on herbs and spices, it's either in a test tube, it's in a mouse study. Some of them are done in humans, but it's really hard to investigate specific biologic actions in a human being in just, one or two, kind of give someone this thing, what are you looking for in their blood? Like, what response are you hoping to see? So a lot of these things are done in test tubes or in animals. And so then the question always is, how does that translate to humans, and what are the factors like absorption or this thing called bioavailability? How do we know how our body takes it up into the tissues? So we have to be mindful that when you see these things, it gets kind of a bummer when you're like, may appears. You're like, I want it to be like strong and like I want to feel really good about this. Feel good about it even if we can't prove it. Incorporate these things even if some of the science is hard to show a black and white clear relationship, and try and see if it makes a difference for you. Every person and everyone's biology is different. So back to some of turmeric's effects, we think it works with isoflavones, which are these hormones that are found in soy foods to suppress the PSA, which is the prostate-specific antigen in prostate cells, via anti-androgen effects. Again, these are complicated things that dietitians don't normally work a lot in, but this is what the science shows, why it can be protective in specific types of diseases. It appears to activate vitamin D receptors. Vitamin D is a big one for cancer, right? We know that people with cancer tend to be vitamin D deficient. We don't know if giving them more vitamin D would prevent it, but nonetheless, if there's some sort of correlation there, if we can improve our vitamin D receptors or activate them, theoretically it's something positive we'd want to do. And then it also appears to have protective effects for the liver. So here are a few of the active compounds, and now I tried to just put a few in there. All of these spices we're going to go through have more than 10 that were listed on the sites and things. So curcumin, that's the most well-researched and the most potent, we think, active compound in turmeric. Alpha-turmerone and polysaccharides are these types of starches. The tip with turmeric is that we can increase the bioavailability, or again, the ability of our body to use the compound when we combine it with black pepper. So it's a little bit tricky in something like oatmeal, it depends on your palate, but potentially you could put a little crack of, I don't know how much, I'm not sure anyone's quantified exactly how much, what's the ratio of black pepper to turmeric, but we know you can heighten the absorption if you combine the two together. Some of the turmeric preparations you can buy in like a tablet form even come with black pepper in them, or a compound called piperin, or a similar sounding name to that. It's the phytochemical that's in black pepper that helps the curcumin to be better absorbed. And turmeric generally pairs well with garlic, citrus, curry spices, and some of the other applications that you all mentioned as well. I've had patients say they put it in their smoothie. Again, you could probably get away with a crack of black pepper if you had enough fruits and veggies and stuff going on in your smoothie. But you can get really creative with how you incorporate some of these things. Be forewarned, it's going to color anything you put it in a very bright yellow color. And again, I would say look at that in the good way. You're like, oh, I know I've gotten something really excellent in here, even though it looks strange. Or, not strange, but just different than what your brain would expect. There's some applications listed on the sheet there again, like how could you incorporate more turmeric? So there's lots of ideas, and these are just a short few suggestions. So then we get to garlic. This one is probably one of the more well-studied, and I would say, most people feel confident saying there's absolutely health benefit to garlic, and therapeutic health benefit to garlic. So it's part of this allium family of vegetables. What are the other, does anyone a gardener in here and know these allium? Onion? They make these beautiful flowers if you like flower gardening, the alliums. So onions, green onion, all that whole family, chives and that kind of thing. So they stimulate the immune system and have anti-inflammatory effects. They may also protect via halting cell cycle progression and inducing apoptosis of cancer cells and decrease angiogenesis. So that's one we want to decrease, right? We don't want these cancer cells to grow more blood vessel form to them. And there is like a trending diet out there. Has anyone heard of like an anti-angiogenic diet? I don't know if there's someone promoting it in particular, but the concept behind the diet is include more of these foods that stop this angiogenesis, and maybe you could like slow down the blood supply to tumor cells. That's the theory behind it. Not all the foods that are on the diet are super healthy, and you should include, is there clinical evidence that shows it makes a difference? We don't know that yet. Hopefully someone will study it soon. So this one, we think it protects in particular against stomach cancer and decreases the risk of developing colon cancer. And again, this in particular, there's like strong evidence where have anyone heard of the American Institute for Cancer Research, that site or the organization? They have an excellent website, aicr.org. They don't really make strong statements unless there's significant scientific evidence to make these statements. And so they have one about colon cancer that garlic intake appears to be especially effective for reducing the risk of developing colon cancer. Lab and animal studies have shown other potential benefits in skin, lung, breast, esophagus, again, colon and stomach. So in humans, we've seen definite benefit for stomach and colon, and then in the lab and animal studies, those plus others. And it also can lower total cholesterol levels and LDL cholesterol, or the bad cholesterol. Does everyone know how to remember good versus bad cholesterol if you're doctors? I remember it lousy cholesterol. So that's my one little way. I can't remember if it's the H, and happy is my HDL. L is lousy, H is happy. So this garlic contains my most favorite phytochemical, Alison, and terpenes, and then saponins. I'm not exactly sure how to say that last one. The most active compound we believe in the garlic is this Alison one. What's the trick with garlic, and it's in the next slide, well, I guess we'll talk first, pairs well with many, many, many foods, but especially tomatoes, dark green vegetables, cauliflower, meat, fish, poultry, and you could add to any recipe that calls for onions or shallots if you don't mind that extra strong garlic taste.
Pairs well in terms of health or in terms of taste?
In terms of taste, good question. Most of the things I talk about tonight are like the health. This one pairs well with on each of those slides is strictly in relation to taste. And if there's a absorption benefit, I'll call that out separately. So like the last one was like the black pepper, but that's a great question. Thank you. So here's the tip with garlic. Raw chopped garlic is the most potent form of garlic. And to really maximize the amount of the Allicin formation is to chop it up or press it or whatever and let it sit there for 10 to 15 minutes before you use it, before you cook it, before you integrate it in your dish. Because that's when it has, again, it's some complicated molecular level that these things undergo a chemical change. And it's believable, right? If you cook garlic, it's like roasted garlic, right? It loses a lot of that like pungency and that strong taste. So it's believable that there can be these chemical changes even within a food by the way you chop it or cook it or whatever. You can clearly taste a taste difference in the garlic raw, sitting there for 10 minutes, or roasted for an hour or something. So optimize the garlic absorption by chopping it and letting it sit there. So ginger here, again, similar looking to turmeric, but a lot more yellow. Native to Asia. A lot of these herbs and spices are from Asia. There's the spice belt, I think is what they call it, basically around the equator, where a lot of herbs and spices grow, but the Mediterranean is another good region too. Again, anti-inflammatory, may lower blood sugar. This one's unique because it has these digestive health or anti-nausea benefits, and also has some anticoagulation effect. So that's stopping blood clotting. Garlic does as well. It should have been included in that last one as well. So may slow blood clotting. which for most people, it's a good thing, right? We're at risk for blood clots or, as in relation to heart conditions or heart disease or strokes. If for some people, if you have clotting disorders, obviously you need to be a little careful of these components that say anticoagulatory effects. But this would be taking a very high amount of some of these things. A little bit of ginger in your pumpkin bread or something is not going to make you bleed. It can again induce apoptosis, or that cell death in gastric cancer cells, can increase levels of certain circulating antioxidants. It's got these unique compounds, gingerol and shogaol, terpenes and volatile oils. Ginger is unique because I think it pairs especially well with both savory and sweet. So anywhere from soy sauce, citrus, chili peppers, but any kind of dessert type of food, carrots, winter squash, fruits, again, garlic. So very versatile. And when you guys eat ginger, what's a unique characteristic of it that I always think about? It's warm and really hot. Yeah, ginger has a really strong heat sensation to it. Similar to like a chili pepper, right? But it's a different kind of heat, I would say. So probably has to do with these, I'm not exactly sure, but I'm assuming these volatile oils could be contributing to some of the heat. So rosemary, now we get to switch to Mediterranean. No more of this Southeast Asia. Mediterranean region for rosemary. It's related to the mint plant. We think it stimulates the immune system, has anti-inflammatory and antioxidant properties, supports circulatory and nervous system. This is a unique benefit of the rosemary plant. And it appears to inhibit cancer cell growth in breast, colon, and lung cancer. So the active compounds here are these things called flavonoids. Again, that terpene word again. It's got this rosmarinic acid. Pairs well with potatoes, right? Rosemary potatoes are probably one of the most delicious things I can think of. Citrus, honey, garlic, onions, chili peppers, chicken, beef, and lamb. Wide application of rosemary. What's your favorite rosemary dish? Or use of rosemary? Everyone's being shy? Chicken, like rubbing it on some, taking some fresh or dried rosemary, rubbing it on the chicken, baking it, right? Mm-hmm. Anyone else have some good application?
I like to put it in my salad dressing.
Oh, nice. Chopped fresh rosemary. Mm-hmm. Is it one of the bouquet garni components? I feel like. Yeah. So if anyone does some French cooking. Huh?
I like it with roasted beets.
Roasted beets, delicious, right? If I'm real lazy, here's one of my, I didn't include it on there, but here's one of my things. Canned beans, or fresh beans, rinse the heck out of them. I like the white cannellini beans. Olive oil, rosemary, shake that up, or stir it up and let it kind of sit for a little while. That's like super delicious to me. Garlic, fresh garlic, please, that sat there for 10 minutes after I chopped it. Delicious, and that you mix a bunch of that and that'll last for days. Put it on your salad, put it on some toast, put it on whatever. So now we're going to, oregano again is another more Mediterranean one. Oregano extract, this is one that's popular as a dietary supplement too, is this oregano, oil of oregano. We think it protects cells from oxidative damage, so again, antioxidant, and radiation-induced DNA damage. And this is not necessarily just talking about, radiation for cancer, but just radiation that we get in the environment. Anti-mutagenic, or a mutation is that word, so anti-mutation, and anti-proliferative, which is again anti-growth properties of these potentially harmful cells. It's got, again, that rosmarinic acid, similar to what's in the rosemary, but it also has this thymol and carvacrol. Pairs really well with tomato, eggplant, broccoli, zucchini, garlic, onions, basil, parsley, lamb, similar to rosemary as far as what it pairs well with. But a totally different taste from rosemary. And rosemary, right, if you've ever rubbed rosemary, you can feel those volatile oils on it, right? It's kind of sticky. Oregano has none of that, but still has, if you had enough oregano, you could extract these like that oil of oregano or these other kind of compounds out of there. Parsley, it's not just the condiment on your dinner plate, right? The garnish. Does anyone use a lot of parsley in their cooking? Yeah? Okay, we've got a few takers. Again, another Mediterranean one. Rich in antioxidants, super high in chlorophyll. Appears to have anti-tumor activity in lung and breast cancer cells. And may also be protective for cardiovascular health and reducing homocysteine levels, partially due to its folic acid content, they believe, which is a B vitamin. So another really good one, don't think of it just as the side dish. Chop up some extra parsley and you can put it on top of almost any savory dish. Top some soup with it.
Is there any benefit to flat leaf versus curly?
Not that I'm aware of. There's probably some very minor differences, just, each plant is slightly different, but it's probably pretty similar. I personally like the flat leaf, if you want to know my opinion. It's a little easier to chop up, I feel like, too. So again, it's got these volatile oils. Some of them are a little different, like the eugenol and the limonene. And the flavonoids, again, and the specific ones are listed there. Pairs really good with lemon zest, mint, garlic, capers, fish, beef. How do you use parsley, fresh or dried? Tabbouleh, classic, right? Cracked bulgur wheat that you've boiled, chopped. I like my tabbouleh to be mostly green, personally, with just a little bit of the cracked bulgur. Lots of fresh lemon or lemon zest. Mint also is frequently put in there. Garlic. I mean, we got all these flavor profiles right here, right? Cucumbers and tomatoes in there. Super easy and delicious. You can make a bunch of it in the last couple days. So cayenne pepper. This is another hot one. Has anyone heard of Master Cleanse? Do you guys know this term, the Master Cleanse? Yeah. Where you drink some lemonade with cayenne pepper in it for a week or something, and maple syrup, yeah. And they say, oh, it's nutritionally complete. And I'm like, oh, sure. So cayenne pepper, though, is highly medicinal. It's been used for, again, thousands of years. Most of the research in cayenne, or a lot of it that's like really strong research, does anyone know what it's for? It's nothing that you would eat. It's something separate from eating. Pain. Topical cayenne, this capsaicin in it, is very effective for pain management. I mean, certain things you cannot put on your skin, like if you have an open wound or something, obviously, you don't want to do that. But there are certain conditions where you can use topical cayenne pepper, and there's different preparations to help relieve pain. So really kind of cool. But also as we ingest it, it also gives us some benefit. In vitro, in the test tube, and animal studies suggest that capsaicin, that compound, causes cell arrest or apoptosis, again, in breast cancer cells. In mice, it downregulated the expression of androgen receptors and slowed growth of prostate cancer cells, again, that androgen word too. May increase insulin levels. When you're like, oh, increase, does that seem good? That's to help bring down blood sugar levels. So again, capsaicin is the compound, but also you notice the red color of that pepper. Beta carotene is orange, but it's also, some of those carotenoids are the red family. So tomatoes are also a good source of beta carotene, even though you may not think that. So zeaxanthin is another common carotenoid in addition to beta carotene. Cayenne is another versatile one, pairs well with sweet and savory. So has anyone had like cayenne spiked chocolate? Yeah, or Mexican hot chocolate, right? If you do Mexican hot chocolate, it has cayenne pepper in there. But also, classic with corn, beans, potatoes, rice, cheese, fish, lobster, right? Cayenne butter on your lobster. Yeah, oh yeah, she's all, I'm writing that one down. Now, green tea, is this an herb or a spice? I don't know. It's I kind of think of it as kind of like an herb or spice. It's not a vegetable. So I included green tea because I think it's important to know all the benefits of green tea. And you can cook with it if you haven't done that already. So it's both a beverage and a medicine. Powerful antioxidant, again, induces the apoptosis, the tumor blood vessel growth, and has antibacterial properties. We think it, in leukemic cells at least, it modulated the VEGF pathway again. It's been shown to slow or prevent cancer development in colon, liver, breast, and prostate cells. Regular consumption of green tea lowers the risk of certain, again, this is human, this is good. Lab studies showed one thing, now we've proved it in some humans. Regular consumption of green tea lowers the risk of bladder, colon, stomach, pancreas, and esophageal cancers. What you do need to be careful for, though, is drinking extremely hot beverages all the time, like ones that burn your throat. Those are not good for cancer risk. You don't want to, heat is another way we can damage our bodies. So if you're constantly exposing your throat to very hot beverages, you could be doing a little bit of damage there. So it's, don't maybe get that extra hot drink at Starbucks and let things cool down a little bit. If it's burning the tissue of your mouth, if you burn your mouth, that's damage. If you do that repeatedly, that can cause some trouble with your body over time. You can't make those repairs as well. So it may also reduce blood pressure, improve mood, and improve glucose tolerance in healthy adults. Active compounds, EGCG, you probably heard of that one, especially they tout it for being able to help with weight loss because it can very, very, very slightly increase your metabolic rate in your body. What we think of it as from a cancer perspective is these catechins that are particularly protective or beneficial. Again, it's got flavonoids, which are good across the board and common in some of the other phytochemicals or the other spices we listed. Pairs well with green leafy vegetables, baked goods, or frequently have green tea in them, fruits, and many other foods, and of course as just a beverage. A quick note, if anyone is on iron supplements or has trouble with anemia and you're on iron, it's better if you separate your consumption of green tea or any kind of teas from your iron tablets, just as a little sidebar, because they kind of compete for absorption in your body. So, anyone else well, first of all, let's talk a little bit about, let me grab real quick, come out of the shot and can I borrow your paper? I should have brought one up to me. She wouldn't mind. Let's talk about some of these applications because this is fun, and if anyone has questions while we're going through here, I'd like you to ask them. So cinnamon, again, we kind of talked about, well, this one I think most people know how to incorporate it. Turmeric, lentil soup, right? Turmeric, the trick with turmeric also, it's a little bit better if you cook it. When you eat it just kind of raw, the flavor, is not quite as delicious, or, it's a little bit bitter. So it's better if you cook it, or, some people that are used to doing curries and Indian foods, if you saute the herbs before you kind of add other foods, you can heighten the flavor a little bit more and potentially improve the bioavailability. But you can add to your favorite lentil soup. Again, you could do Greek yogurt or a plain yogurt, adding the turmeric, and you can make like a dip for, a healthier kind of veggie dip. And I would do turmeric and black pepper and some other curry spices and things. I borrowed yours. Do you need it?
Oh,
Mm-hmm.
yes,
this one?
because I like to write.
All right.
Too.
Let me get a different
Add
one.
things I missed. Is that okay?
Yeah, please. There's plenty more.
And you meant ginger here instead of garlic, I think.
Oh, I'm sorry. Yes, but you can do either one of those two things, actually.
Really?
Ginger or garlic to a fresh stir fry. So let's see. Or like deviled eggs, right? You already got that, or egg salad. You've got that yellow color already. Throw in some extra turmeric and some black pepper. Another one, this is an interesting way to use herbs and spices. Instead of just using plain water to cook rice or a grain, what if you have some turmeric and black pepper in that water? It'll give it a yellow color, but you can do that with the turmeric spice. Similarly, green tea. You can boil rice or any kind of grain in some brewed green tea and potentially give it some extra benefit and a little bit of a flavor profile as well. Garlic, I feel like most people know pretty good ways to incorporate garlic, but I'll plug for more beans since she mentioned the chopped garlic in our beans with rosemary. Ginger makes delicious beverages, right? So don't forget using herbs and spices in our beverages. You can make little slices of the ginger. My patients call it ginger coins, and you can kind of boil it with some water, maybe a little touch of honey, and you can make a little beverage or a squeeze of lemon or something. And this, we know, it can help reduce some of the chemotherapy-induced nausea and vomiting. You don't have to do a lot of it, it's just a little bit. Most of the science or most of the convincing evidence in humans is that it's helpful in nausea induced by pregnancy, but it also does have some benefits in chemotherapy-induced nausea. Let's see. Putting some fresh ground ginger, cloves, something like that on top of cut up fruit. I just did this the other day, or like some cardamom and cinnamon and ginger or something. You gotta be careful not to overdo it because of that hot spice, but that can really liven up a fruit salad, some chopped up fruits. Or again, like sliced bananas with some sprinkle of cinnamon on top of it.
What was it, cinnamon, ginger, and what?
Like cardamom, ground cardamom, or cloves or something like that. Or, pumpkin pie spice, that spice blend is a lot of those spices already pre-mixed together. I think it's got cinnamon, nutmeg, cloves, ginger. Let's see. So the rosemary, again, rubbing on the meats like we talked, mash any kind of potato dish, add it to a veggie omelet. You can do a sprinkle of herbs and things. Say you're making a sandwich. Don't miss the opportunity to put some fresh basil leaves on it. Or even if you don't have anything fresh, sprinkle the bread or the meat or the cheese or veggies or whatever's on there with some extra herbs and spices. Curry's real good in tuna salad, so excellent suggestion. Curry powder with a little extra turmeric or something in there. You can definitely jazz up any kind of dish. You know, with herbs and spices, you probably have to have some kind of moistness to the dish because they're powdered, you know, so you kind of have to make it stick to the food a little bit. So some olive oil, some mayo, so something, or some lemon juice, something like that. Or a salad, like Holly mentioned. You can chop fresh rosemary, put it in your salad dressing. You could just have a green salad you put together, it's already dressed, and sprinkle some extra herbs and spices on top if you don't want to flavor everyone's salad that way. You're just doing yours. Or you can put chopped fresh cilantro or chopped fresh parsley on top of a green salad. Or they even have those herb salad blends now. Have you guys had those where it's like baby greens with herbs blended into them? So those are kind of good. Let's see. Oregano's classically with any kind of tomato dish, of course. You know, add it, stir extra into a tomato sauce or sprinkle it on pizza or some kind of tomato soup or something like that. I would say, or a dollop of pesto, right? If you do the raw garlic and the parsley and basil on top of a bowl of soup. That's another French style of doing your soups.
It's good on lamb.
Pesto or oregano?
Oh, the oregano.
Yeah. Mm-hmm.
Majorum.
There you go. And those are very similar. Those two herbs are like very close family-wise. If oregano is too bitter for you, a lot of people will say use the marjoram instead. Mm-hmm. Let's see. You can also make this fun thing, parsley tea. I've not personally tried it, but as I was putting together this sheet for this talk, you pour a cup of boiling water over a 1/4 cup of fresh parsley, and you allow it to steep for 5 to 7 minutes. Strain and enjoy. You can add, you know, little flavor tweaks if you want to make it taste better. Or just bring out different aspects of the taste. But it's a way to incorporate an herb or spice in an unusual way. The cayenne peppers, if you've never had a margarita with a little dash of cayenne in it, I highly recommend that. But you can also put it in sauteed veggies, scrambled eggs, beans. If you want to do the virgin version of that, you can do it in your lemonade. So maybe not master cleanse, but still the same concept of the lemonade with cayenne pepper or the hot chocolate. And then green tea, there's a bunch of recipes I found here because I thought this is probably the most unusual one that you probably don't know how to incorporate it. There's 2 forms of green tea that you can use in baking. You can cut open a tea bag and use those green tea leaves if you want to, or there's like matcha green tea powder, which you probably have to find, and you have to go out of your way to find this matcha green tea powder. But that one's super easy because it's kind of pulverized and it's not like green tea leaves that might grow and expand and have a bigger flavor hit. But either one you like, either one's fine. But you can use brewed and chilled green tea for milk or water in like certain baking recipes, or again in your oatmeal, or you can be kind of creative. People have come up with all kinds of ways. Poach pears in green tea, delicious. And again, use some other herbs and spices in there too. Matcha powder in your plain yogurt, it will turn it green, but it'll still taste delicious, and it has a good, pleasant flavor. Let's see, you can use brewed green tea when you're brining meats instead of just plain water. Kind of interesting. Again, adding other herbs and spices and salt and things. You can even sprinkle green tea leaves into a stir fry, which again, not something I've done, but I can imagine it would be delicious. Or in the food processor, blend nuts, green tea leaves, and use it like as a crust when you're going to broil some fish or something. Mm-hmm. Oh yeah, people are very creative with these ways. You can use it as the base of a smoothie instead of using, juice or something like that. You could use some green tea. Does anyone have their suggestions of how to incorporate some of these herbs and spices? Any other really creative ways you want to share?
I drink a lot of green tea, but via celestial seasonings, the little tea bag. Can I just eat the stuff and have the same effect?
You can. Mm-hmm. You can eat the green tea.
But positive results. Okay,
Absolutely, absolutely. You're probably going to get more of the caffeine content. So if you're caffeine sensitive and you're eating the whole leaves, so just keep that in mind. But you'll probably get even more benefit from.
Good news.
Yeah, good. You like it? Yes, sir.
The ones that you've mentioned, but can you tell us anything about the benefits of asafoetida?
I'm not familiar with that term.
Indian spice.
I don't know that one. Does anyone else here know that herb or spice?
I heard it as asafoetida. I don't know how it's pronounced, but
Oh,
it's like a garlic. It smells like garlic, and in fact, the name is like really actually means rotting corpse. But it's heavily used for.
I believe that's, yeah. I mean, a rotting garlic smell. Yeah, I can believe that.
Some people can't. Some groups, religious groups, won't eat garlic or onions, and so that's a substitute for those.
Oh, interesting. Okay, yeah, like in yogic. Yeah, I know you're not supposed to eat garlic and onions, so. There is a site where we can look up some of these herbs and spices. So if you want, we can go look at that really quick. I've included in the further reading in the back here, the Memorial Sloan Kettering Cancer Center. Well, first there's the AICR, the website I was telling you about. They talk more about food in general and cancer prevention, risk reduction, lifestyle changes and modifications to reduce your risk of cancer in the first place, cancer recurrence, and they also have tips and things for people that are in active treatment. Memorial Sloan Kettering Cancer Center has an excellent integrative medicine section of their website where you can look up many of these herbs and spices. We can look and see if that one you mentioned is on there to find that specific herb. What the site on the Memorial Sloan Kettering really points out is the medicinal aspects. It won't really talk about, food and how to incorporate it that way. A recently published book, I didn't give a complete, reference here, but you'll be able to find it with Google, thankfully, nowadays. It's easy to find these things. Eating on the Wild Side, has anyone heard of that book? Yeah, I haven't read it yet, but it's on my list. Have you heard of it? Yeah. So this woman, she's an investigative journalist, and she's put together this book that talks all about how do we get the most out of the food that we're eating nowadays, and talks about. So she's like one, about the garlic and letting it sit, or that different varieties of certain, so this is kind of off because she's talking about a lot about fruits and vegetables instead of herbs and spices, but how we bred out some of the health benefits of different fruits and vegetables, because we bred them for things like taste or the look or perfect shape, but that necessarily wasn't the best for our health and getting the most vitamins and minerals out of these things or the phytochemicals. So she talks a lot in her book about like cooked blueberries, right, are better than, or not better, I shouldn't say better. Cooked blueberries have more phytochemical available to us than the raw blueberries, or she has lots of good tips like that. Or, which variety of apple is going to give you the most phytochemicals, things like that. So her book should be pretty interesting. There's some videos and stuff if you Google her name.
Isn't it the red ones? Don't they say that the red, because of the color?
According to her, Granny Smith is like one of the best apples, and that's easy to get. Also, like Honeycrisp variety, she particularly mentioned was beneficial. It tends to be heirloom varietals that have, more. But yeah, you're right. The red skin, you would think, oh, that's a bright red color. It's sometimes true, sometimes not. It's kind of tricky. Yeah, and like kind of green. Mm-hmm. But they're real tart, so maybe that strong tart flavor is part of the benefit. So then there's also the American Cancer Society has some information on some of the different herbs and spices that people use medicinally. There's also, if you really want the technical stuff on some of these herbs and spices and other phytochemicals, there's the Linus Pauling Institute on Micronutrient Research for Optimum Health. So they have a great website. McCormick Science Institute, McCormick Spices, who knew? I didn't know. They have an excellent health benefits of herbs and spices section of their site, in addition to many different delicious recipes. Some of them are healthier than others, so you have to kind of use your judgment there, but they have a lot of recipes to choose from there. Do we have time to look at that Memorial Sloan Kettering? Yeah, let's do it. Again, I'm not, Memorial Sloan Kettering is a great place. They just have an excellent website, so that's why I'm promoting it in particular. It's open to the public, which is what's unique about it, because a lot of these, I don't know if I have internet. Do I? a lot of these, some of these sites where you can learn about medicinal herbs and spices are like subscription or things like that. So this one's nice because it's free, but I'm not sure we have internet anyway. That's okay. Please check out on your own the Memorial Sloan Kettering Cancer Center Integrative Medicine website. Yes?
Do you have the PowerPoint slides posted where we could download them?
They will be posted on the Cancer Supportive Care Program website within 2 weeks. Or no?
Will be up in 2 weeks.
Video
We'll
in
get
2
the
weeks.
PowerPoint up hopefully tomorrow or the next.
Oh, good.
Or Monday.
Do you have a URL or anything?
Let's see. Yes.
Yes. It's cancer.stanford.edu/cancer supportive care, all one word.
And Holly, so the website is cancer.stanford.edu/cancer supportive care. And it's written down on those
It's on the back of
the booklets over there. Mm-hmm.
I have a question on the back of this one,
Yes.
and it talks about how long to keep your spices.
Mm-hmm.
Is there a big difference between fresh? I guess fresh is just, you can see when it's too old. So this is just for dried.
So, good question. So she's asking about the handout that is from the SCAN DPG that talks about, it has pictures of the herbs and says what they pair well with. And on the back side of it, it says for how long to keep them. And so her question is that referring to fresh or dried? And yeah, it's probably referring to dried because, you know, spices will sit in your cabinet for, last time I looked through my grandmother's cabinet, I think those were from the 70s, you know, probably good to get a new one. Many natural food stores also have bulk spices. So if you want to get, if you just need a pinch of something, you can go to the bulk section and just get a couple tablespoons of something, and then you don't feel like it's going to go bad, and it'll be relatively fresh. So,
What do you mean by whole 2 to 5 years? Whole what?
do you mind if I borrow that just to see what she's talking
It's
about?
a whole spice, like a clove or?
Oh, yes. Whole versus ground. Good question. Because like a whole nutmeg will last a lot longer than nutmeg powder. Part of that has to do with oxidation or the exposure of the spice to air, and that'll kind of degrade it over time. So, he had a question here first.
Is there any problem with freezing dried spices and herbs?
I would think that generally that would prolong the life. I would think, I don't know for sure, but just based on how other foods last longer, it seems to me that it would help prolong the life of an herb or spice. So that's a great way if you're like, I bought this whole container of this, how can I make it last longer? Storing things out of direct sunlight or heat, or, you know, maybe not putting spices above where you do a lot of boiling and things, you know, if your spices are right above your stove, or if it's very hot there, you know, so it's a great idea. Cool, dry, dark is how generally things will last longer.
Flaxseed, whole or ground? What is better?
Ground. But you should try to grind it as fresh to the time you're going to eat it as possible. Or if you grind it up ahead of time or you buy it ground, keep it in the fridge. Yeah, keep it in the refrigerator. In as airtight of a container as you can.
Thank you.
Good question. Oh, sorry, I should have repeated.
Mixtures, so you don't have to keep track of so many different kinds of
Yes.
spices?
There are many different spice combinations. You know, will it be the exact one you want? You know, maybe, maybe not, but like the McCormick people and different other spice companies have made blends of herbs and spices. So it's very easy if you feel like, I don't want to have all these jars of things. You can get these pre-made blends, and they probably have paired them in just the right way and the proportions that it'll taste the best too. And again, a lot of people use those instead of adding salt to food. So you could definitely do that.
Are there guidelines in terms of quantity?
So
Is a sprinkle
there are
sufficient?
not guidelines in general. That's a good question. The question was, are there guidelines on how many herbs and spices to add every day? You know, an individual herb or spice, you know, will have some variability. The problem is we don't know exactly how much of the active compounds are in each of those things and how long you've had it, you know, how was the plant, you know, super high. It's all kind of estimates. So there aren't specific guidelines for how much. Garlic, they say 1 clove a day, which is kind of a lot. 1 fresh clove of garlic a day. Bravo to anyone who's doing that. That was the only one I can think of offhand that has specific, or like some of the if you're looking for a specific thing like to lower blood sugar from cinnamon, there is some guideline like a teaspoon or 2. I'm not exactly sure what it is, but some of those, if you're looking for a specific medicinal purpose, there will be some guidelines, but you have to investigate it a little bit and look to the science for it.
And do you suggest being kind of generous with our sprinklings as opposed to?
Absolutely. So I do suggest being generous, kind of go to the strong side of the taste if you can tolerate it. If you're not used to using these things, start with small amounts and then work your way up. Or just, start adding them in where you wouldn't normally. If breakfast you use no herbs and spices, make that. If you don't want strong rosemary flavor on everything at lunch and dinner, maybe you could just start by adding in a new spice at a meal you don't normally add a spice. So the absolute amounts, it's not like fruits and vegetables where we say eat 2 or 3 fruits a day, eat 4 or 5 veggies. It's just kind of use more herbs and spices is the general recommendation. Yeah.
What is the difference between an herb and a spice?
Oh, that is a great question. Do you know the answer? Please share. Leaves.
Spices are seeds.
Seeds. Okay. Because, generally, that probably generally covers it. Because then like cinnamon, well then what's that? It's bark. So, or like saffron is the stamen or something like that in a crocus plant. So yeah, generally, probably herb is the leaf, spice is the berry. And I would say, oh yeah, because there's roots, like ginger and turmeric, yeah. I don't know if that's a good question. I'd say, that's why I use both terms all night long, since I don't know the answer. Okay, I'm working my way back, yes.
Do you know if there's a difference in efficacy for fresh versus dry, and also freeze, say garlic versus fresh? Is it less potent or is it equally?
So that's, some of that information might be available and some of it may be unknown. But I'd say generally, as a generality, fresher is going to be more potent unless it has some of those tricks where it's like, oh, more bioavailability cooked. But as a general, fresh, close to the time it was picked from the plant, and that is going to be better. However, that's hard to have all the time. So anyway, you're incorporating more herbs and spices. The freezing of ginger or garlic or something, I don't know. Do you know, Freddie? I have no idea. I don't know what's the answer to that. And there's also these chopped up preparations of herbs that you can get refrigerated in tubes and things that have, and so those are kind of convenient, right? I would think that they have some kind of preservative in there to help make them last longer, but I don't know if that's just a spoilage or if that protects the phytochemical content. I'm not sure. Or like the jarred chopped garlic, because it's been jarred, it probably has lost some of, because they have to heat treat it to make it last. It's probably lost some of the benefit. And I don't know if they let it sit before they cooked it and all that stuff. But fresh is generally ideal.
They don't mention majoram. Is that because it doesn't have any they can't name every
Right.
one. But is that because it doesn't have any particular thing they know that's preventative or really helpful?
It probably, the marjoram, I don't know, whichever way, it probably has benefits that are very similar to the oregano. It probably does. It's not called out in particular just because there are, like you mentioned, so many different herbs and spices. And how does one thing get studied more than other? It's seeing some kind of trend in the benefit of food or someone doing research just like, well, let me just see what are the active components in this food and can we use it. With herbs and spices, we've learned over time, on human observation, which ones seem worth studying more than others, where scientists will put their time and money into. There was a question in the back, I'm sorry.
Any negative side effects of the long-term use of, say, turmeric?
So the question is there any long-term side effect of prolonged use of turmeric? I would say generally as long as you're using the amount found in food, normal amounts found in food is kind of this expression they'll use versus medicinal amounts, it's absolutely safe, right? If you grew up in India, you've probably eaten a lot of turmeric in your life, right? Or if you continue to cook that way. So I'm not aware of any negative, only the positives. But of course, anything we overdo, if you're only doing turmeric, you have the risk of a toxicity, even of a good thing, right? Even too much of a good thing, prolonged over a very long time, can be harmful. So normal food amounts. Thank you. Have a good night. Any other questions? Are we over on time? Sorry.
No, you're fine.
Okay, good. So anyone that wants to hang out can hang out.
I've got a question. I often hear the term micronutrients.
Yes.
Spices.
So the question is, define that term, micronutrient. So micronutrient refers to vitamins and minerals generally, but I would say it also probably includes these phytochemicals. The difference between a micronutrient and a macronutrient is macronutrients are like protein, fiber, carbohydrate, fat. Those are the macronutrients, and then micronutrients are generally vitamins and minerals. This is a newer term or a newer area of study in general. So yes, I would call these micronutrients, even though they may not, I don't know if anyone's particularly defined them that way. But like when I learned in nutrition school, there's macro and micronutrients. And they say vitamins and minerals are the micro, but I think phytochemicals too. They didn't teach me much about phytochemicals in school when I was in school.
This isn't a question about herbs or spices, I'm sorry,
yeah.
but someone asked me to ask you about sprouts and the nutritional benefit of sprouted greens versus greens that you would put in salad.
Sure.
Is there any specific benefit of using sprouted?
My understanding is there is particular benefit of using sprouted, like broccoli sprouts are a really commonly used sprout, or alfalfa sprouts or something like that. Chia sprouts people do too. My understanding of how they're beneficial, though this is totally just reading things about it, non-scientific, that I am aware of, is that they tend to be high in enzymes, so they can help us to digest food a little bit better. They tend to be very rich in these phytochemicals, and if you're not likely to cook them. So some of the phytochemicals that are sensitive to heat, you won't be damaging, like broccoli and cruciferous vegetables are very healthful, but if we overcook them, they lose a lot of that benefit. But for me personally, to eat raw broccoli, I don't love it. So if you can kind of lightly steam it and get away with it, or broccoli sprouts, it's many different beginnings of broccoli plants, just barely sprouting. I think it is supposed to be very rich in these phytochemicals, antioxidants, and that kind of thing. But I'm not sure. Anyone else know particular for broccoli sprouts or any sprouted vegetable? Generally, they're very good for us. If you're immune compromised, if your immune system is particularly low, I recommend doing your own sprouts because they tend to be a food that can have contamination or can have bacteria growing on them. So just be careful with them. Mm-hmm.
Can any of these herbs and spices be used on the skin to prevent skin cancer?
Yes. So, yes, I know. I didn't, there are some of them. I'm trying to remember offhand which ones, but they have studied that, because it's the same thing, like, can you topically reduce some of the damage, that our skin occurs? I want to say turmeric was one of them, but I cannot recall off the top of my head. There are ways, if you kind of did a PubMed search. Anyone use PubMed to kind of look for these things? You can only get the abstracts if you don't have access, but you can do a PubMed search and look. There are certain phytochemicals that have been studied for reducing, they'll say reducing the abnormal cell growth versus saying absolutely prevents, skin cancer, but it can reduce some of the growth, yeah. Lycopene is one.
Tomatoes with some kind of fat, like olive oil, before you go out in the sun.
Oh, interesting. So, yeah, that makes sense. Beta carotene has a role in our skin health, and our eye health and other things. So, yeah, in general, trying to eat as many of these things can be protective internally, but yeah, topically, there are some studies, yes. But I can't recall, truthfully, off the top of my head.
My mom is concerned about
spinach have some sort of acid in there, which I don't really know how to translate to English.
Oh, okay. A lot of people ask about oxalate in spinach. Is that familiar? Does that sound like right? Maybe. Mm-hmm. So, and I've read it too, where some people say, oh, you absolutely can't have any raw spinach. My understanding is you can. I don't know that it's proven that it's a problem to have these raw spinach. There again, I say try to have variety, you know, sometimes raw, sometimes cooked. More importantly is whichever way you'll eat more of it, you know, because we want to be getting more of these foods. So whichever preparation you like the best, do that one since you'll be more likely to eat more of it. So raw spinach or not, it's not my understanding that it's a problem, but some people strongly believe that it is. It's nothing I've ever read scientifically to be a problem. Mm-hmm. Mm-hmm. So to repeat, in case anyone didn't hear what she was saying, so spinach and certain other vegetables contain these things called oxalate, and the American Heart Association, you said, had?
Journal of American Medical Association.
Oh, Journal of the American Medical Association. So a doctor or someone must have written in like a case study or something where a patient had eaten many foods that were high in oxalate and ended up having kidney damage. There are these things called oxalate kidney stones. You know, would the average person have a problem with eating a lot of oxalate? It's not likely. You know, you probably have to be someone that tends to form these oxalate stones. But you're absolutely right. She said, if you balance your diet, this is the key. If you balance it with other minerals, if you're kind of not overdoing one food in particular, if you're drinking plenty of fluids also, that's also really important for preventing kidney stones. And you're also not having too many of these like acid forming foods, they call them. So a nice, healthy, balanced diet and not overdoing foods that are high in oxalate or any food in particular. This is how we keep our body healthy and in balance for sure. So yeah, it sounds like it was a case report to kind of bring it to people's attention that this is a risk factor for people that are overdoing oxalate. Yeah.
Are there any, or is it a totally different animal, any foods or herbs and spices that you've talked to that particularly help arthritis?
Turmeric, for sure, has been studied for that because of its anti-inflammatory effects. There are some more like medicinal ones that I'm familiar with, like holy basil.
Basil?
Well, it's this other kind of basil. I would say turmeric for the arthritis. If you have pain from the arthritis, that's where maybe the capsaicin, I'm not sure, if topical cayenne pepper or whatever. Maybe. Any of those foods, though, any of the spices that say anti-inflammatory have the potential for the arthritis effects. Yeah, but you could probably look up certain conditions and see if it says. I mean, generally, like omega-3 fats also, we think. Omega-3 fats, like in fish oil or hemp seeds or that. I know it's kind of, yeah, some people use those for arthritis. Mm-hmm. Or eating salmon or something. No, orally.
Oh, okay.
And turmeric orally too. There was, right behind you, there was a question, I'm sorry. And so you had one in the red? Did you have it still? Yeah.
No, when you're done, I just wanted to ask you, I brought the things up on.
Oh, good, you got the internet? Good.
Yeah, well, their internet, I couldn't hook to the Wi-Fi because I didn't have the password.
Okay, so I can bring that Memorial Sloan Kettering site up if anyone wants to look at it afterward. So what was your question?
I wonder if there are any particular ones of these spices that are bad for acid reflux.
That's a great question. So are any particular spices bad for acid reflux? So what we say is that, no food, peppermint you're not supposed to have for acid reflux. The reason for that, even though you think, oh, it's going to be soothing, right? There's a little, at the bottom of your esophagus, oops, sorry, I forgot about the microphone. At the bottom of your esophagus, there's a little muscle called the pyloric sphincter, and it closes off your esophagus from acid contents refluxing back up. Peppermint is supposed to relax that muscle, so then food is more likely to reflux back up there. So we say, to avoid peppermint, or I think even spearmint, any of those kind of mint family ones, may relax that lower esophageal sphincter thing. Or did I, oh yeah, I'm sorry, it's the lower esophageal sphincter, or is it, anyway. So it will relax that little muscle, so you're more likely to reflux. Now, will anything increase the acidity of that stomach acid that's already in there below that little muscle? Generally, we say that no food is more acidic than your own stomach acid. You know, that stomach acid is really strong. However, if you have reflux and you've had some cayenne pepper and that's coming back up into your esophagus, that's probably going to hurt, you know, more than normal. It won't necessarily make the reflux worse, but you're going to feel it a lot more. And a lot of people have the silent reflux where they're not aware that they're having reflux, but that may actually be a good thing if you're like, oh, I got heartburn when I have this chili peppers. Maybe you're silently refluxing all the other times, but just don't feel it. So, you know, be sure to check with your doctor about that. Mm-hmm. So the question was not drinking tea while eating. The only thing that comes to mind was the thing I was talking about, the like iron absorption. So teas contain these things, I think it's phytic acid, I think, in it, that can sometimes impair the absorption of certain nutrients. It doesn't, you know, it doesn't change your digestion per se, but it may block the absorption of certain other nutrients. There are lots of these kind of things that happen in food in general because just certain things are in competition. You know, I think, you know, people have been drinking tea with meals for thousands of years and they don't have severe nutritional problems. So I don't think it's a huge concern. Yes, you can separate fluids from a meal by 30 minutes or something if you want to, or the tea from the meal, or drink water. But I'm not aware that it's a necessity. You know, it's not something we learn or that we recommend for patients to do across the board unless you're having these iron absorption problems or some other condition.
Kind of also recommend using tea for cooking.
Yeah.
So is that kind of contradicting?
No, that's what I'm saying. We don't recommend that you have to avoid tea with meals. So doing that, you know, is not necessary.
Okay.
Mm-hmm.
Well, the other thing that I heard is, what I was told is don't take your vitamin with tea.
That could have to do with these absorption issues. And again, like the one I'm most aware of is iron having the most significant reduced absorption if you combined multivitamin with tea, you know, or drink them at the same time. So it probably would be prudent to, you know, separate them. It's, you know, it's hard to know how strong of an effect that's going to be. But if you're worried about it, it's easy to drink with water instead of tea. But mostly, my understanding is, or I would guess, it has mostly to do with iron absorption and why she's reading about that. But you know, sometimes you have to be careful of what you read on the internet because it's not always true, you know? It could be someone's opinion or, you know, maybe one study showed it, but you have to repeat these things to make it be meaningful or something we actually need to be concerned about. Or sometimes they'll say, oh, if you take this with this, it reduces the absorption. But if it reduces it by like 2%, is that significant? You know, we also have to understand clinical significance. Yes, it's true, but is it meaningful in our body or not? What was your question?
Yeah, I wanted to ask, you know, we were talking about acid reflux.
Mm-hmm.
Are there any foods that are more alkaline in nature?
So this is a common question. She's asking about, are there foods that are more alkaline in nature? So this is a common question I get of like, do I need to follow an alkaline diet to help reduce my cancer risk? It's a good question, and it's very popular out there. So what's tricky is that you'll see like lemon juice is alkaline, right? And you think, oh, but that seems so acidic. But what they say is that, you know, how your body processes it, the end product is that it promotes alkalinity, not acidity. There's the lists I've seen that say this. Well, so the question is, so generally, yes, fruits and vegetables and like milk and yogurt and a few other things tend to be more alkaline forming in the body, where like meats and processed grains and things like that, high fat type meats, tend to be more acid forming. The real question is this, you know, super significant and something we have to do a big thing about? I mean, yes, we should be eating more fruits and vegetables and less meats and stuff. So if you do the normal balanced diet, you're kind of covered for that alkaline ash thing. I don't think you have to be a very strict only alkaline forming foods, and no acid forming foods. Most people's diets are a combination. Just tend more for these fruits, veggies, and that'll cover you from that alkaline concern and perspective.
Just to respond, fennel seeds, would they be a good digestive,
Yes,
cognitive?
that's a great suggestion. Many different herbs and spices are supposed to have some kind of like indigestion promoting or improving function. So she said fennel seeds. So if anyone's gone to an Indian restaurant and they have that little spice when you leave, that they serve that partially to promote good digestion. Fenugreek is also supposed to reduce some of the indigestion. The ginger we were talking about earlier. So there's many different herbs and spices you can try to see if they'll promote good digestion. And some, again, some have indigestion is a very vague thing in general, so it's kind of hard to study. But subjectively, people say it improves the way they feel after eating a meal. Mm-hmm.
What about taking digestive enzyme?
So taking digestive enzyme is the question. So from the medical perspective, we do prescribe digestive enzymes sometimes for patients, but it's very specific conditions that we believe need them. And enzymes are a protein. And our body, when you take it into your stomach, the acid environment will kind of start breaking down that protein. So we think that most of the over-the-counter digestive enzymes have a very limited ability to help us digest food because you're just going to break it down so quickly, and use it like a protein. But they have these special enterically coated enzymes that will withstand the acid environment of the stomach and be activated in the small intestine, where they help us kind of digest the food a bit more further down, where our pancreas and all those other enzymes come into play further down. They come like in the duodenum, jejunum region of the small intestine, if you want to know, more detail than you wanted to know. But your bile duct will carry these enzymes, and they normally are active in our small intestine. Some enzymes are in our stomach. There's several enzymes up in there, but a lot of them come in further down the pipe. So our stomach doesn't normally have to have this don't digest these enzymes function. But when we take them orally in these supplements, it's limited evidence of if they make a difference or not. Some people think like papaya enzyme or papain or this thing called bromelain in pineapple, they think that can help us like digest proteins a little bit. It's totally subjective, I would say. I don't know if we know for sure if it makes a difference. But it's, they're not harmful. It's just whether or not it's going to help.
Is it similar with probiotics, yogurts?
So probiotics are a little bit different than the digestive enzymes. Probiotics are these good bacteria that we find naturally in our diet in fermented foods. And some of them live in like dirt and soil and stuff like that too. So you may, take them in unknowingly, if there's a little dirt or residue. So probiotics, there are a bunch of trillions of bacteria that live in our digestive tract, particularly the further down you go, the closer you get to the colon, there's more of these bacteria living in our gut. And most people, when they think of why should we take probiotics, they think you may have an imbalance of some of the probiotics in your body, like you maybe don't have enough of certain types of probiotics or more of these bad, these negative bugs in your gut. So there's this concept of balancing the flora or these bacteria in the gut. So this is a hot area of research. There are studies that look at how can probiotics improve our digestive health. And there is promising research. We know that taking probiotics can reduce the risk of antibiotic-associated diarrhea, that they can, for some people, reduce like heartburn and indigestion and things. They can improve things like motility or how things move through our digestive tract. Some of the science is even looking at how can they affect things like memory, or how can they affect things like arthritis and like anti-inflammatory functions, because a majority of our immune system lives in our gut. And so if you have a healthy gut with these good bacteria, theoretically you're going to improve your immune system as well, or just your entire body. So taking probiotic supplements, they are supposed to be able to withstand the stomach. So it is beneficial to take them orally, they will survive in your stomach, and they'll, get further down to where they're really going to be active, further down in your small intestine. But yeah, they're usually given orally. So, and they're... So fermented foods that are high in probiotics are like yogurt and kefir, like miso, kombucha, raw sauerkraut, raw pickles. These are some of our fermented foods. They naturally contain probiotic, but in much smaller amounts than what are in some of the like pill preparations. And it's just hard to know, like, was that food stored in a way that didn't, kill the probiotics? Because some of them are sensitive to time and temperature and that kind of thing, or whatever else is in that food, So most of the time, to like guarantee some amount of probiotic, it'd have to be from a dietary supplement versus from a food. Mm-hmm.
I sometimes chew and clatter my teeth to simulate saliva flow, promote enzyme flow. I feel better afterwards. Is it all in my head, or is it actually?
Oh, I think it's real. I mean, imagine when you think about something that's delicious, your mouth waters. Your body's preparing for this food to come in. Our saliva has enzymes in it. One of them is called salivary amylase, but there's other ones too. So it, potentially that could help with digestion. For sure, it'll improve flow. So when you stimulate your body, or it thinks food is coming, the little muscles that line your intestinal tract will kind of start moving a little bit more. So it could help, move things through your system a little bit. But I think it's real. I believe mind-body connection is huge. So if you believe it, it's real too. Uh-huh.
Back to the probiotics. You were mentioning how the stomach acid pretty well breaks down any living stuff. How does like Flora store powder that you mix with water as a probiotic? I can't believe that every granule of the powder is enteric coated. So how does it make it through the stomach?
So the Flora Store and probiotics aren't enterically coated, but many types of bacteria are acid resistant. So, we do think that they can survive, or at least, when we've given people high enough doses, maybe that's another thing, the dose, high enough doses of probiotics, we can see differences in they'll take a sample from the digestive tract and they'll see changes in those bacteria. So we do think, a reasonable enough amount of these good bacteria are surviving the stomach environment and making it to the small intestine and the large intestine. Yeah, you're right, it's a good question, but bacteria can be real tough. So.
I have another question. It's also one thing that my mom keeps telling me not to do is eating bananas on my empty stomach, or like tomatoes. Like there's like a list of foods that she doesn't want me to touch when I'm on my empty stomach.
Okay, so whether or not we need to avoid certain fruits and vegetables on an empty stomach, including tomatoes and bananas, I'm not aware of any valid scientific reason that you can't eat that on an empty stomach. If you feel bad when you eat that on an empty stomach, I think your own self-experiment, if you feel bad afterward, then maybe don't do it. But I'm not aware of a scientific reason that you can't have bananas on an empty stomach or tomato on an empty stomach. I don't know.
I think it's like something she reads, but I don't know exactly where it comes from.
I know. This is another reason you must be careful where you read. Generally, go to some reputable scientific websites, or if you read something you're like, I wonder about that, try to do more research and look it up and prove it to yourself, instead of just taking someone else's word for it. Anyone can write a website on the internet, so.
Well, Alison, thank you very much.
Thank you. Thanks, everyone. Great questions.